prime objective of the World Health Organization is the fight against disease on a global scale.
We started giving all three drugs together, and to our astonishment, by being meticulous, we found we weren't getting any failures. Nobody believed us.
On this World Tuberculosis Day, let us reaffirm our commitment to tackle this deadly disease together.
You can't control tuberculosis if you don't control tobacco use.
This is a moment for us all to collectively step up our commitment to ending TB.
Good afternoon. My name is Keren Middelkoop, and I am the chair of the Coordinating Committee of Scientific Activities at the Union. The Union's awards are an important way in which we recognize some of the valuable work being conducted by those dedicated to lung health around the world. And this year, on behalf of the CCSA, I am delighted to be presenting 4 scientific awards to 4 highly deserving individuals. The first award is the Carol Stieblo Public Health Prize. This prize is named in honor of Dr. Carol Stieblo, the Director of Scientific Activities at the Union from 1979 to 1991. Dr. Stieblo played a central role in developing the Union TB control model that was later branded as DOTS by the WHO. This prize acknowledges an individual or community organization for their contributions to TB control over a period of 10 years or more. Dr. Edward Nardell is an associate physician in the divisions of Global Health Equity and Pulmonary and Critical Care at the Brigham and Women's Hospital in Boston, Massachusetts. He is a professor of medicine at the Harvard Medical School and also a professor in the Departments of Environmental Health and Immunology and Infectious Diseases at the T.H. Chan Harvard School for Public Health. From his early involvement in the field as a TB controller for the state of Massachusetts in the 1980s, Dr. Nardell has become a tireless advocate, researcher, and educator in the field of TB infection control. He has published extensively on this topic and most recently highlighted the impact of climate change on environmental controls for TB transmission. Ed Nardell has applied the lessons learned on TB infection control to other areas such as measles control and now preventing COVID-19 transmission. For a decade, he co-directed a course at Harvard, teaching architects and engineers from around the world how to design buildings to prevent airborne infections. With South African colleagues, he has established the Airborne Infections Research Facility near Pretoria, quantifying the effectiveness of various TB transmission control interventions. He championed the FAST core package in TB infection, which is currently implemented throughout the world. He has also conducted pioneering studies in the emerging field of inhalable TB drugs as both treatment and to stop transmission of highly drug-resistant TB strains. It gives me great pleasure to present virtually Dr. Nardell with the Carol Stieblo Public Health Prize in recognition of his contribution to public health in a career spanning over 4 decades. Ed has very kindly donated his prize money to the Union. The second award to be presented today is the Union Scientific Prize, which acknowledges researchers at any stage of their career for work in lung health that has been published in the past 5 years. Robert Wilkinson is a physician-scientist who is a professor in infectious diseases at the Imperial College London and a group leader at the Francis Crick Institute, also in London. In the last 16 years, he has been partially seconded to the University of Cape Town, where he directs the Institute's Wellcome Centre for Infectious Diseases Research in Africa. Professor Wilkinson's research interest for the last 27 years has been understanding and intervening in HIV-associated TB. His achievements lie in understanding the human immune response to TB, especially in the context of HIV co-infection, and on the translation of this knowledge into novel intervention strategies. Recent research includes the evaluation of novel TB vaccines, contributions to the understanding that TB infection occurs as a spectrum, hence offering the opportunity for more effective stratification of risk to progression, and clinical trials of improved therapies for TB meningitis. I am delighted to award Professor Robert Wilkinson the Union Scientific Prize for his impressive contributions to HIV-associated TB spanning nearly 30 years. The next prize is the Union's Young Investigator Prize. This was established in 2011 to acknowledge researchers for work in lung health published in the past 5 years when he or she was aged 35 years or younger. Dr. Leonardo Martinez is an infectious disease epidemiologist whose research focuses on understanding population and individual level approaches to controlling pediatric TB. He also concentrates on the epidemiology of TB in other high-risk and neglected groups, including incarcerated populations and persons living with HIV and diabetes. Dr. Martinez is currently a postdoctoral research fellow at the Stanford University School of Medicine, and in January 2021, he will join Boston University's School of Public Health as an assistant professor in the Department of Epidemiology. Dr. Martinez has 45 peer-reviewed manuscripts, 24 as first or co-first author. Recent Lancet publications provide critically important data and comprehensive updates of epidemiology relevant to TB transmission, risks for infection and disease, and child contact screening and management. The work challenges some of the field's long-held assumptions and provides fresh, high-quality evidence. His recent comprehensive systematic review and meta-analysis of the risk of TB in children after a close exposure was published by The Lancet and involves an analysis of individual data from over 137,000 children. Please join with me to congratulate Leo Martinez in receiving this year's Union's Young Investigator Prize, recognizing his exceptional work in the past 5 years. The Stephen Lawn TB HIV Research Leadership Prize was established in 2016. Many of us remember Steve Lawn, who worked tirelessly to improve the lives of people with TB and HIV, particularly in the field of TB diagnostics. Steve sadly passed away in 2016. This prize, established in his memory, is a global partnership between the TB Centre at the London School of Hygiene and Tropical Medicine, the Desmond Tutu HIV Centre in Cape Town, and the Union. The award recognises the work of young researchers who are conducting promising research focused on reducing disease burden of TB and HIV in Africa. Dr. Nicole Salazar-Austin spent several years as a global health core physician with the Baylor International Pediatric AIDS Initiative in Eswatini, before returning to the US and completing a fellowship in pediatric infectious disease and a master's degree in epidemiology. She is now an assistant professor in the Department of Pediatrics at the Johns Hopkins School of Medicine and has recently been awarded a K23 Career Development Award from the National Institutes of Health. Dr. Salazar-Austin's research focuses on combining existent and new biomedical interventions in TB with novel high care delivery models to improve implementation of TB preventative treatment in TB-exposed pregnant women, children, and adolescents, both with and without HIV worldwide. She is also leading 2 PK studies that will define 1-HP dosing and safety in children, and a second that will define the drug-drug interaction between 3-HP and dolutegravir for children and adolescents. Dr. Salazar-Austin has demonstrated excellence in leading original work that has immense potential to improve clinical outcomes in mothers and infants co-infected or exposed to HIV. It gives me great pleasure to award Dr. Salazar-Austin with the Stephen Lawn TB HIV Research Leadership Prize in recognition of her innovation and leadership. Thank you for joining me today to recognize these outstanding awardees. I want to thank all the nominees, nominators, and the reviewers for participating in this year's awards program, despite the time pressures that COVID has placed on our busy lives. I offer a final congratulations to all our awardees, and I hope that we have the opportunity to congratulate you in person in the near future.
The Princess Chichibu Memorial TB Global Award. This award has been given every year at the World Conference on Lung Health since 1998 by the Japan Anti-TB Association in collaboration with the Union, in recognition of distinguished achievements in international anti-tuberculosis activities. The award is presented by Her Imperial Highness Crown Princess Akishino, the patroness of the Japan Anti-Tuberculosis Association. The late Princess Chichibu had been the patroness of the Japan Anti-Tuberculosis Association, JATA, from its foundation in 1939. Shortly after she had started to serve as patroness, her husband, Prince Chichibu, a brother of Emperor Showa, suffered from tuberculosis and passed away after more than 10 years of struggle. Based on this sad experience, Princess Chichibu further devoted herself throughout her life to the prevention of tuberculosis. This award was initiated based on her wishes to make the world free from TB. The winner of this award for 2020 is Dr. Soumya Swaminathan, Chief Scientist of the WHO. She is an internationally renowned pediatrician and clinical scientist of tuberculosis, especially tuberculosis in children and tuberculosis co-infected with HIV/AIDS. She took important posts such as Director General at Indian Council of Medical Research, Secretary to the Government of India for Health Research, and Director at National Institute for Research in Tuberculosis in India. Now, Her Imperial Highness Crown Princess Akishino, the patroness of the Japan Anti-Tuberculosis Association, presents the award.
It is a great pleasure for me to present the Princess Chichibu Memorial TB Global Award. I would like to thank the Union for its long-term collaboration with Japan Anti-Tuberculosis Association. Dr. Soumya Swaminathan, the winner of this year's award, has devoted her professional life to offering her warm-hearted support to those without a voice, such as children with TB. She has worked in India for many years, displaying a deep empathy with patients suffering socioeconomic difficulties. Internationally, she has contributed to the global efforts to respond to TB and HIV. I am sure that she will achieve further success in promoting global health by strengthening scientific research based on human values. On behalf of Japan Anti-Tuberculosis Association and the Union, I would like to offer the Princess Chichibu Memorial TB Global Award for 2020 to Dr. Soumya Swaminathan for her outstanding contribution to global TB control. Congratulations.
I would like to convey my deepest gratitude and appreciation to the Japanese Anti-TB Association and the Chief Patron, Her Royal Highness Princess Akishino, for recognizing me and my work on tuberculosis with the Princess Chichibu Global TB Award. I take it as a recognition not just of the work that I have done on tuberculosis, but of my many colleagues in India and around the world who have focused on research in order to improve the diagnosis and treatment and care of patients with tuberculosis all around the world. Thank you so much. I'm honored.
RD Marte, and I'm a health and rights activist from the Philippines. I currently head a regional civil society network called APCASO, and in 2016, I and my organization helped form a regional TB activist coalition called ACT Asia Pacific. In 2018, I needed to start seeing doctors because of persistent bouts of coughing and difficulty breathing, and I was diagnosed with asthma and prescribed asthma medications. In that same year, I needed to keep coming back to the hospital because of the still persistent coughing, and I was told that on top of asthma, probably I also had allergies that triggered my coughing. I got tested inexpensively for all kinds or for many kinds of allergies. But to this day, if I indeed do have allergies and what kind of allergies I have remain a mystery. Nonetheless, I was prescribed with anti-allergy medications. Early this year, I needed to get myself checked again by the doctors because of more persistent coughing and also this time fever and joint pains. In my head, I was guessing, was I having more asthma attacks? Were my allergies getting triggered? Could it be TB? Something which I've kept on asking my doctors to get me checked for. But they kept on dismissing. Could it be COVID-19? I told my doctors I travel a lot because of my work. I also attend a lot of meetings where the people I meet also travel a lot. And I also interact a lot with communities that are vulnerable to TB. But my doctors always believed they knew more than I do. I was never tested for TB or COVID-19, even if a thick nodular lesion was found in one of my lungs in February. I continued to be diagnosed with asthma and allergies until about 3 months ago this year, when my doctor relented to considering the possibility of another lung disease when the lesion in my lung wasn't getting smaller despite of months of asthma medication. I was asked to undergo blood testing again, and the results, according to my doctor, confirms that I have TB on top of the asthma and allergies. I was given the choice of starting right away on a course of TB drugs, Rifampicin. I asked if my TB was latent or active and was told it was something in between. And all this was happening at a swanky, supposedly 5-star hospital in a developing Asian country. Because I am privileged to be working in a field where I have friends or friends of friends who are TB experts and/or/TB survivors themselves, I was able to get advice before deciding to take on the prescribed TB medication. I was advised to ask first for drug susceptibility and for gene expert testing. I did, and my doctor acted offended, indignant, and aggressively condescending. Long story short, in the end, it was found out that my lung lesion was at least 2 years old and was indeed from TB. But my body self-healed at some point for some reason. Up to now, I still do not know exactly what to make out of that eventual diagnosis, but I am thankful that I got saved from needing to take unnecessary TB drugs prescribed to me. I also know that despite of all the hoo-ha, I am lucky and privileged. When I was sick or getting health checks, I could easily take paid leaves. Most of my expenses were covered by our office health insurance. I had my colleagues at the office and around the world helping me with hospital staff, with information, and connecting me with their own doctor colleagues. My partner, family members, and friends showed me nothing but love, support, and concern. I had no issues in forming close contacts. It did not even enter my mind that I would face stigma from any of them. I am privileged, and yet in the midst of my original diagnosis of active TB, I still couldn't escape some thoughts from running in my head. Oh no, many of my loved ones are immunocompromised. Who could I have unknowingly infected? Oh no, what would this mean for my visa renewal? In fact, I kept on asking my doctor if their government will be notified of my positive TB diagnosis. In the country where I work, TB infection is a basis for denying of visa application and renewals, and I needed that visa to continue to work where I work. Another question, what happens if my landlady finds out about my TB diagnosis? With regards to my asthma, I consider it an annoyance mostly, plus something to be fearful of as a factor of vulnerability for COVID-19. But my main concern is what happens when I return to the Philippines and I no longer have access to insurance that covers my expensive medications. I have been an activist most of my adult life. I considered myself an empowered woman. While I am a migrant worker, I have work documentation, unlike millions of other migrants who cannot even go to health centers even if they are feeling health issues for fear that they will be sent back to their countries outside of their will just because they don't have proper work documentation or because of their non-documented migrant status. If I wasn't a privileged person, I would have taken the TB drugs prescribed to me even if they were unnecessary. Side effects and future susceptibility be damned. If I wasn't privileged, the consequences of my lung issues, including the TB diagnosis, would not just be a few days of fear and annoyance. It will be far more heartbreaking and life-altering. And this is why I consider that the greatest privilege of all is actually having opportunities to try to change this world. I hope stories like mine continue reminding the Union and the broader global health community of why we need to keep on doing the work that we do, of why we need to keep on pushing for people-centered and rights-based health responses, of why we need to keep on having platforms for continued dialogues between affected communities and communities of researchers, of doctors, of health professionals, and of donors. Because it should be a matter of rights and not privilege that determine a person's health and life outcomes. And bringing us closer to this vision is what to me should be the measure and of real success and meaning of union in these conferences and in future conferences. Thank you.
Hi. It's a great pleasure to be able to join you at the end of your conference. I'm only sorry that it hasn't been possible for us to meet in person. Let's hope that we'll be able to meet physically at future conferences. 6 years ago, I addressed your conference in Barcelona. A few members of parliament attended. We decided to set up the Global TB Caucus because we knew that TB needed a stronger political voice. Since then, the caucus has grown hugely. We now number 2,500 parliamentarians in 130 countries. We've set up 43 new national TB caucuses, most recently in Pakistan, where there were very few before, ensuring that TB has a voice in the parliaments around the world. We've spoken up and organized, of course, in our own countries, but also together. We've taken action to get TB onto the G7 agenda, the G20 agenda, and of course, at the high-level meeting in New York. I think there's one person who deserves much more public credit for the launch of the caucus and for what has been achieved, and that's José Castro. right from the beginning, he was the caucus's strongest supporter. He enabled it to happen by hosting our first meeting at your conference. He continued to ensure that the union gave the caucus its full support. It was very much emblematic, I think, of Jose's tremendous leadership in the world of TB. I will always be immensely grateful to him for what he did for the caucus, but also for the fight against TB generally. We'll miss him from the union, but are delighted that he will continue to be engaged in these issues, and I look forward to continuing to work with him, as I do with the union. It was with high hopes that we went to that high-level meeting in New York 2 years ago. The declaration that was agreed was strong. It recommitted the world to action against tuberculosis. It set ambitious new treatment targets to ensure that we would get back on course to meet the Sustainable Development Goal to beat the epidemic in 10 years' time. But of course, COVID has intervened. And the truth is that actually, even if it hadn't, we would have still been off target. Now we're even more dramatically off target. In the words of Maru Pai, if we had a mountain to climb before, it's just become Everest. I hardly need to tell you what every report has shown, that there has been a huge transfer of healthcare resource away from the existing epidemics and, of course, other diseases towards the fight against COVID. And there's been a transfer of political attention too. COVID has seized the world's leaders, its parliamentarians, knowing that they have to deliver in the fight against this disease, which has, frankly, frightened and affected everybody. And the position now has become one that is very serious for the existing diseases, which continue to exact a terrible death toll themselves. What then to do? Well, I just want to say two things. First of all, we have to speak up. We owe it to our communities to continue to take a stance, to use our voice, to ask that political leaders don't forget tuberculosis. We must do that. It's not enough, and it's never been enough to continue the fantastic work that everybody here does as scientists and doctors and researchers and members of NGOs in their own organizations. We have to work together and we have to speak up. We have to ensure that TB has a stronger voice, and we have to work together to make that so. And the need has never been greater. So this is not a time to be silent or to be cowed or to think that it's not possible for us to make the case for TB. Actually, the need has only become more urgent. And the second thing that I would say is that we don't have to present some kind of alternative between tackling COVID and dealing with TB. It's easy, of course, to see things in that binary way. But the truth is that global health security has now rocketed up the political agenda. Politicians weren't really talking about this before, and they are now. They know that tackling infectious diseases is something that can't be ignored. They know the economic and humanitarian toll that can be exacted. We were making the case that they should tackle TB in its own right and because of the risk of AMR. Actually, a new disease has come along, and yes, an airborne infectious disease that affects the lungs, that can kill people. It was a different disease, but the battle against these diseases is one that has to be fought together. The solutions have to be found together. And in the future, what is it that we will need to ensure that we can achieve that global health security? Well, it will be better surveillance. It will be resilient healthcare systems. It will be universal healthcare coverage. It will be stronger primary healthcare. It will be better diagnostics and treatment ability. It will be stronger investment in R&D so that we have the tools to fight these diseases. Let's not see these things as alternatives. I know that it's hard not to at a time when resources have been switched away from TB, but in the end, the fact that COVID has arrived has only increased the salience of global health security in today's political discourse. And that is, if it's possible to look on the bright side, one opportunity that arises from both terrible diseases, that actually we can now grab political attention and ensure that these diseases are finally beaten. It's T-10 years away from that sustainable development goal target. We mustn't give up. We must continue to draw the attention of the world's political leaders to the need to beat a disease that still claims the lives of 1.5 million people a year and will continue to do so unless we take further action. Don't let's believe that we are asking politicians to make a choice. We're asking them to focus on the need to ensure health security across the piece. It's our responsibility to do that as elected parliamentarians for the people we represent, and it's our collective responsibility, I would argue, to work together to ensure that this disease can be beaten. TB has always been the orphan disease. It feels even more of an orphan now. Well, we don't just ignore the orphans, we do something about it. So this is 6 years on, another call to arms. We need a new plan. We need to work together. We need to raise our voices again, and we need to ensure that TB is not forgotten and that we continue the fight against this disease. I look forward to continuing to work with the Union, with the Stop TB Partnership, with the WHO, with all the NGOs, and with all of you to ensure that at last we can end TB. Thank you.
I want to thank Nick, now Lord Herbert of South Downs, for his kind words and for his support to the Union over the years. I remember meeting him in London for the first time in 2014. He shared his vision for creating a global network of parliamentarians focused on TB, and we agreed to work together to launch the Global TB Caucus at the next Union conference in Barcelona. Since then, the caucus has become the largest network of its kind working on any health issue. I am grateful for the work that Nick and the caucus secretariat and all of the MPs around the world are doing today. This is a poignant moment for me. It is the final time I am addressing you as the Executive Director of the Union. It has been my honor to serve you as the 8th Executive Director. The Union is a unique and essential organization. We are scientists and researchers. We are health workers on the front lines. We are government officials. We are survivors and people from affected communities. We are advocates and activists. Together, we create a foundation of knowledge and expertise that rivals any university or government agency. But we all understand that it is not enough to know how to end tuberculosis, or to know how to defeat the tobacco industry, or to know how to stop a child from dying from pneumonia. We understand that we need to share that knowledge with the purpose of moving the world to action. Knowledge in the service of action. This is what makes the Union. And it is what has made being part of the Union so special to me, because I have gotten to learn from you and work in solidarity with you. And I'm very proud of what we have achieved together. Our scientific approach to public health continues to break ground and produce best practices like Detect Child TB and TB Data for Health. Our scientific approach to public health continues to break ground and produce best practices like Detect Child TB and TB Data for Health. Researchers trained through our Center for Operational Research have published more than 1,000 peer-reviewed articles. But we are going beyond simply publishing. We are actually tracking the impact of that research on health policy and practice. In India, we shared information about tuberculosis with more than 20 million households. More than 120,000 people received a diagnosis and treatment as a result of that outreach. In sharing our members' research with journalists, we have earned media coverage in more than 1,000 news outlets in 100 countries. We have strengthened our partnership with affected communities, creating the Union Community Advisory Panel and convening the first ever Survivors Summit. We are advocating with governments around the world and played a vital role in the United Nations high-level meetings on TB and NCDs. In Latin America, we are the leading organization assisting countries to become smoke-free. In Myanmar, we now provide antiretroviral therapy to more than 33,000 people, almost double the number in 2013, and the community-based MDR-TB care program covers a population of 6 million. And in the course of conducting this work, the Union has grown to over 600 staff and consultants across the globe. Moving into its second century, the Union is needed now more than ever. Whether it's COVID-19, TB, air pollution, or all of the diseases caused by smoking tobacco, many of the most critical health challenges people face today are respiratory. These are exactly the problems that the Union knows how to solve, and I know that we will solve them. That is because the Union's people are among the most intelligent and committed people I have ever met. I have valued my time with the Union more than I can express, and I look forward to remaining your partner. Thank you for the opportunity to serve you as the 8th Executive Director. It was a great honor and a privilege.
Distinguished delegates, members of the Union, ladies and gentlemen, it is with humility, honor, and my privilege and pleasure to present to you the winners of this year's Union honorary members. Allow me to remind you that honorary membership of the Union is granted to a person who has dedicated him or herself to the service of the Union and distinguished themselves through active participation in activities of the Union to support the fulfillment of its goals. These members serve as informal advisors to the Union. This year, we have 3 remarkable people. Professor Ouma Basso from Guinea-Conakry is a mentor, a teacher, a distinguished scholar, and public health practitioner who has been a major contributor to the war against TB. Her achievements in the fight against TB won her the Karel Stiblo Public Health Award in 2003 and the Africa Hero Award in 2017. Professor Gigi Wang from China has been a dedicated member of the large number of soldiers in the trenches of the war against TB. Leading from the front, Professor Wang has ably led the Centers for Disease Control in China, has been engaged in technical working groups at the World Health Organization, and has been a leader of the TB section at the Union, among other high-profile engagements. Dr. Dean Schraffnagel, and again, forgive me, Dean, if I mispronounced that name, from the United States, has had more than 3 decades of engagement with the Union. His support to the Union has been manifold and includes having been a long-term benefactor member, a member of the board and its bureau when he served as the vice president, and has been the efficient manager of the Union's Christmas sales and stamps program and contest. Ladies and gentlemen, wherever you are this hour, please put your hands together to clap for these wonderful people. And now, ladies and gentlemen, allow me to introduce to you this year's winner of the Union Medal. But before I do that, permit me to remind you that the Union Medal is the Union's highest honor and is awarded to members who have made outstanding contribution to the control of tuberculosis or lung health by their scientific work and or actions in the field. This year, this medal is presented to my mentor and friend, Professor Philip Hopewell from the United States of America. Phil has done many great things, and I could talk about these things for forever, or like they say back home, until the cows come home. So forgive me, Phil, for I will only mention a few of the great things that you have done. Phil has been president of the American Thoracic Society, an organization that, like ours, is trying to improve lung health, not just in the US, but globally. Phil has been heavily engaged in tuberculosis research and has worked closely with key organizations in the global fight against TB, such as the World Health Organization and the United States Agency for International Development, among many others. You will all remember the zeal and passion Phil displayed when he steered the development of the international standards for tuberculosis care and the efforts to engage the non-state sector in TB care and prevention that we call PPM. Ladies and gentlemen, may I request that we put our hands together to clap for Phil Hopewell as he receives this award.
Well, thank you very much. It's truly an honor to be this year's recipient of the Union Medal. I have to confess that my first response on receiving the news that I was to be the recipient was shock. I knew something was afoot from within our group, but I actually didn't really cooperate with that effort. My second response was embarrassment. And the embarrassment stems from my recognition that many of the predecessors who have received this medal contributed much more to the Union than I, and much more globally to tuberculosis and lung disease. Persons such as Andrew Nunn, Denny Mitchison, Jacques Grosset, and importantly to me, John Murray, who was a mentor, colleague, and friend for many years at San Francisco General Hospital, who contributed much to the Union over a long period of time, and who died this past spring of COVID-19. There are many people that I have to thank for this award. First of all, I think is my wife. My first opportunity to participate in any sort of international work in tuberculosis came when I received a call from the US CDC asking if I could run a project in Eastern Nigeria. It seemed like a bit of a far-fetched idea, but I talked it over with my wife and said, would you like to go to Nigeria for several months? Ended up being 6 months. And neglecting to mention that this was a war zone at the time, her response was, sure. And we went together with our then 2-year-old daughter, and I think all three of us actually benefited from the experience. A similar occurrence happened with my involvement in a project in Peru when I was asked by the Union to run a project beginning implementation of what was then considered short course chemotherapy for tuberculosis in Peru. And again, I asked how she would like to spend a few months in Peru. Ended up being a year. Again, she said, sure. So, and again, we both benefited benefited from and enjoyed our experience there. I also need to thank my group at San Francisco General Hospital, a group of former trainees, now colleagues and friends with whom I'm very proud to work. They mounted a campaign that I think Joe Biden could probably use in the campaigns in which he is currently participating. And then finally, the committee, the awards committee chaired by my friend Jeremiah Chakaya, a man who I both respect and admire. I am only sorry that I won't be there to receive the medal in person and to enjoy this with Chakaya. Finally, I'd like to say that it seems like the union at this point in time is ever more relevant than it has been in the past. With the COVID-19 pandemic and with the United States basically withdrawing from the international scene, from providing any global leadership with regard to respiratory diseases or any other health issue for that matter. So let me say again that I am truly honored and would like to thank all those who are responsible for my receiving this award. Thank you very much.
Your Imperial Highness, Crown Princess Akishino of Japan, Your Royal Highness, Princess Dina Mired of Jordan, honoured guests, distinguished members of the Union, conference participants, thank you for your participation in this 51st World Conference on Lung Health. I want to begin by offering my congratulations to all the award recipients, the new honorary members, and to Professor Phil Hopewell, the Union medalists. What an outstanding cast of heroes we have seen here today. They typify the selfless dedication, the commitment to science, knowledge, and our mission to end suffering due to tuberculosis and lung diseases that has sustained the Union for 100 years. I also want to thank all those people who have made this conference not only possible, but an outstanding success. The close collaboration between teams of members and staff, led by Dr. Keren Middelkoop, the chair of the Coordinating Committee of Scientific Activities, and Mr. David Jackson, the Director of Conferences, underpins this successful outcome. In these extraordinary times, the good grace, flexibility, and patience of all those involved, including the presenters and the attendees, has been hugely appreciated. I believe we will learn from this experience. While getting together in person will always be welcome and valuable, the increased accessibility afforded by the online environment is something that we will not easily surrender. This year marks José Luis Castro's last conference as Executive Director of the Union. José joined the Union in 2001 as the Director of Finance and Development, became the Deputy Executive Director in 2008, Interim Executive Director in 2013, and Executive Director in 2014. One of his first contributions to the Union was launching the International Management Development Program to provide training in management, budgeting, and logistics. Since its inception, this program has trained more than 4,000 managers from NGOs and government agencies in 30 countries. Subsequently, he has been instrumental in the success of key projects, such as the Bloomberg Initiative to reduce tobacco use. During his tenure, the Union has expanded its global portfolio of projects and forged new strategic partnerships, including with the Global Fund, USAID, DFID, and Bloomberg Philanthropies. As you heard just now from the Right Honourable Lord Herbert of South Downs, in 2014, José co-founded the Global TB Caucus, an international network of over 2,300 parliamentarians from more than 132 countries. This initiative remains one of the world's largest political networks dedicated to advancing a global health priority. José is leaving the union on the 31st of October to be the full-time president and CEO of Vital Strategies. I want to take this opportunity to thank him on behalf of myself, the board, and the members of the union for his outstanding service. I wish him well in his future role and look forward to continuing to work closely with him personally and with Vital Strategies. Over the past several months, the board and the Bureau have undertaken an extensive search for a new executive director. We have received many excellent applicants. It reflects well on the esteem in which the union is held that such high-level applicants have expressed interest in leading us. While we had intended to announce a new executive director at this Union World Conference, the difficulties we are facing now has meant that the Bureau, our board's executive committee, has decided not to make an appointment at this time. Instead, the Bureau has recommended that, as president, I step into the role of interim executive director for the coming months, until we conclude that the time is right to make a permanent appointment of an executive director. As I take on this new role, I'm acutely aware of the turbulent environment in which we are now operating. Despite the increased financial challenges caused by COVID-19, I'm happy to report that we have secured more than 22 million euros in dedicated project funding for the coming year. However, we do face some financial headwinds. The board and I have been very closely engaged in dealing with the challenges faced by the organisation and remain committed to forging a positive path for the future. The financial road ahead will not be easy, but I am confident that the union is well positioned to navigate this changing environment. Your continued support of the union remains an integral part of this. Thank you for your attendance at this 51st World Conference on Lung Health. I wish you a healthy and successful year ahead.
My lung health hope for the future is equity, that they have access to quality healthcare, diagnosis, treatment for their lung health issues. That is my dream, and I hope we can achieve it.
Is to achieve universal access to high quality diagnosis and patient-centered treatment.
For enlightened governments to make available the resources necessary and to implement them.
The affected communities and the scientific community are working hand in hand to push for high quality healthcare for all.
Is that the energy that has galvanized respiratory professionals during this year is sustained to increase the fight against tuberculosis.
We can recruit more and more young scientists in the fight against TB.
In future, I would like to see a tobacco-free world.
Happy 100th birthday to the Union. The Union has been a great force in the conquest of tuberculosis in the last century. My hope is that it oversees TB elimination in the next 2 decades. What a wonderful gift that would be to the world.